What about horses that are existing people own, like say 5 to 10 horses, and they are we, as a recommended deworming practice, are we recommending that those horses get fecal exams as well?
I think it's a good idea just to find out who your major donors are
Mm,
to the pasture. And you may decide that there's one or two horses that you want to knock that level down. And you're going to find in general that the young horses, the 1, 2, 3, 4 year olds will tend to have higher counts, their immune system gets better, and then we'll find that the other end of the line, the late teenagers, or even if we have some that are old enough to vote, those are ones that are more likely to have the higher counts just because of age and exposure, immune system, and so on. The other seems to be very much an individual sort of thing, that we'll find that at a certain time we may find this horse is fairly high and it's not high again for a long time.
mm,
And only deworm those that need it under most conditions.
okay.
And some of those most conditions would be, hey, if we've got some horses coming in and out, I mentioned the tapeworm.
Mhm.
The tapeworm could come from a pasture, but it also could come from some nice fresh hay that came from someplace else, because there's an intermediate host for the tapeworm, which is a small, uh, very small mite that lives out in the pasture, and it looks mostly for insects to kill.
Mhm.
But if it finds a worm egg, it bites into the worm egg and sucks out the goodies, and it becomes infected, and the horse will eat it because they're on the vegetation, because that's where the insects they normally feed on are
Mhm.
going to be. And we'll find in this part of the world that most of that transmission of that parasite occurs in the latter part of the grazing season. In other parts of the country, it may be a different time of the year that we tend to see more of them.
Okay.
But that's one that we do see from time to time cause some problems. And one of the things that we'll see with horses that have tapeworms before they get large numbers is they'll just do a lot more stretching and looking at their side like, I don't feel real comfortable. But then when they get going and you check everything else is fine, but
Mhm.
they're just a little bit uncomfortable.
Right.
And there's a reason for that.
Mhm.
The reason for that is that this species of tapeworm that causes the problem lives at the junction of the large and small intestine. It's a very small tapeworm, but if there's large numbers of them there, they are attached to this opening between the two, and they sort of cause it to swell up, and so that the normal gas that's produced in the gut gets held in the small intestine instead of passing out the other end. And that causes the horse to be uncomfortable. There are rarely, there's been some other things where this has been completely blocked due to this particular parasite. And it's one that in our part of the world, perhaps it wouldn't be a bad idea to maybe treat the horses um, as we go into the wintertime with a drug that would affect that tapeworm, the strongyles that are in the, and some other things that will cause some problems from time to time but don't cause any disease. Bots. People have all seen bots and they think, oh, they're terrible. Yeah, the adult bot fly flying around makes horses uncomfortable. Do they hurt them? No. Does the bot attached to the stomach hurt them? No. But they do bother the horses. And so not having them in there would be a good thing. And many times we'll use a combination drug at that time of the year. And that is it also covers pretty much everything except the tapeworm.
Okay.
And to me, if we're going to do a deworming of a horse at a time of the year, that would be the time.
Okay.
And that's what we'd get more bang for the buck.
Okay.
And any other deworming, hey, if they need it, do it. If they don't, don't.
Okay. And that's what the fecal exam will tell you
Yeah,
if
and
they need
that's
it
what
or
the
they don't.
fecal exam will tell us.
Okay. And the veterinarian, will they be able to recommend a product for, depending on the results of the fecal exam?
Should be able to.
Okay.
Yeah. And but a lot of that will have to do with, okay, what has been used on this place over a period of time, what works on this place. And this is one of the things, particularly with larger farms, but even small ones with 10 horses or something like that, this idea of testing the drug at that farm every several years is not a bad idea. In other words, we get a sample before these guys have got high levels, we'll treat them, and then 2 weeks later we go back and we check them again. And our numbers, if they haven't fallen considerably, we're going to say, hey, that drug's out. How long is it going to be out? Well, probably after 40 or 50 years, be okay again.
Okay.
but I don't think those horses will be there.
Probably not. Okay, very good.